that all relates to rheumatology, rheumatic diseases, and arthritis. So measles has been much more in the news lately. It is spreading a little bit more than it used to. It is a disease that is very contagious. It is airborne and can easily spread without you even knowing it. So you can spread it. If you have measles, you can spread it to the next person before you actually have symptoms. Once you develop symptoms, that can include things like fever, cough, or runny nose. And classically is the skin rash, which is a blotchy red rash, which usually occurs a few days after the fever itself starts. Where it gets more serious, though, is about 10% of people will develop lung infections or ear infections, and 1 in 1,000 people can have swelling of the brain. And that can cause a whole host of issues, including things like seizures for the rest of your life, deafness, and permanent brain damage. And while not as common, death can occur up to 3 in 1,000 people. And of course, measles affects everyone, particularly children, something that we ideally don't want to see in our youth or really anyone. Unfortunately, once someone has measles, we don't have great treatment. It's really around supportive care to make them feel better while the body fights off the virus itself. We don't have a good antiviral, or more commonly called antibiotic sort of medication to treat measles, which means the best treatment is really to prevent the infection from occurring in the first place, and that means a vaccine. So fortunately, for many years now, we've had a vaccine for measles. It comes in what's called the MMR vaccine. That stands for measles, mumps, and rubella. Rubella, also known as German measles vaccine. So this vaccine can protect against all 3 of these conditions. What makes this vaccine unique and really important to be aware of for those who have a rheumatology condition is that it is a live attenuated vaccine, meaning this vaccine contains a weakened form of a live virus. The vast majority of people, because it's a weakened form, it does not cause the infection itself, but that's again in the usual population. We'll talk about why that's important for those with arthritis in a moment. Also important to note though, the vast majority of other vaccines out there, things like the flu shot or COVID vaccine and so forth, are not live attenuated vaccines. They're usually based on a protein or something that looks similar to the actual virus or bug, but do not have the virus in itself. So very safe and strongly encouraged in our population to get vaccines like that without any concerns. The MMR vaccine typically requires 2 doses, and if you receive both those doses, it is nearly 100% effective at preventing measles. So it works very, very well. And in fact, if 95% of the population had this vaccine, it would dramatically reduce the spread of measles. And the reason why we're seeing increased numbers is because that vaccination rate is lower than it used to be. Now, some of that is because of concerns of side effects and so forth, and we'll talk about that in a second. But should you get the MMR vaccine? So in general, and this is before speaking about folks who have arthritis or rheumatic disease specifically, if you were born before 1970, you probably had measles or were exposed to it, meaning that you developed antibodies and you're probably protected. If you were born after 1970, and again, this is when we started to see the vaccine being used, ideally, you should receive the 2 doses of MMR. As we said, that's what provides you the best protection. Sometimes you can get a blood test to see if you are protected, if you only had 1 dose, to see if that was good enough. But even then, 2 doses is better. Nowadays, the recommendation routinely is to receive that first dose of the MMR vaccine around the age of 1, and you receive a second dose usually just before starting kindergarten. If you did not get either or one of these, it is certainly okay to get them later in life. So better late than never sort of thing. The side effects are generally pretty minimal for the vast majority of people when they get this vaccine. So certainly it's an injection, so you can get rarely an injection site reaction. About 5% of people, or 1 in 20, will have some body chills or even fever a couple weeks after the vaccine. And this is normal. It's not necessarily an active infection or anything like that. It's the immune system's response to the vaccine. It means has activated in forming the antibodies and doing the things that we want it to do to prevent that bug from actually causing a problem if you're exposed in the future. Like anything you put in your body, there's also a rare chance of allergic reaction, but again, this is very uncommon. So what about the MMR vaccine for those who have arthritis or rheumatic disease? So this comes back to the comment we made earlier that this vaccine is live attenuated, meaning it is a weakened form of a live virus. But because those who have rheumatic disease are often on treatment, and those treatments modulate the immune system, things like disease-modifying anti-rheumatic drugs, or DMARDs for rheumatoid arthritis, psoriatic arthritis, medications for lupus, and so forth, being on those medications means getting a live attenuated vaccine, including MMR, is contraindicated. So generally, it's not safe to do both at the same time. So if you need to receive the vaccine, is there still a way to do it? There is, although maybe not the most ideal way. So usually what's recommended is that you can receive the MMR vaccine, but you have to be off your DMARD for at least 3 months, basically, so it's out of your system. You get the vaccine, and then you get it safely because you're off those DMARDs. And then you can restart your DMARD, but about 4 weeks later. So that's about at least 4 months of being off your disease-modifying agent. And if you have rheumatoid arthritis, that's potentially enough time for the arthritis to become active again. So there's some risk on both sides, because we also don't want your arthritis to become active and start to have pain, stiffness, swelling, and so forth again. So there's a balance here. In some cases, and this always requires discussion with your rheumatologist, we can give MMR vaccine a little bit sooner, and this is really about what your risk is. So with methotrexate or leflunomide, maybe after being off it for a month, maybe a week for a JAK kinase inhibitor, which is a synthetic, newer type of DMARD. If you're on a biologic, maybe after 1 dosing interval. So ideally you want 3, what would be the equivalent of 3 dosing intervals to be off a DMARD biologic before getting MMR. So if normally your biologic is once a week, you'd be off for at least 3 weeks. If it's once a month, that's still quite a while, obviously. Of note, we're talking about DMARDs and biologics, but 2 in particular are probably not an issue at all, hydroxychloroquine and sulfasalazine. They are very, very gentle when it comes to the immune system, and we would consider those safe and likely okay to proceed with an MMR vaccine while being on those 2 medications. So if you're uncomfortable getting the MMR vaccine because you don't want to stop your DMARDs, then what do we do? Particularly, what do we do if you've been exposed to measles? So there's a couple things that can be considered. So at that time, if you know there's been exposure, this might be, from a benefit risk point of view, an ideal opportunity to get an MMR vaccine, because the benefit of it to prevent having a measles active infection may make sense. But more often than not, may be a candidate for what's called intravenous immunoglobulin, or IVIG, which is a blood product which pools antibodies from lots of other people together, and it's given to individuals through an IV or intravenous therapy, and that ideally fights off any virus that might be in you as well. And obviously that takes a little bit of arranging to make that happen. The vaccine, again, MMR vaccine in this situation for things like methotrexate, probably leflunomide, sulfasalazine, plaquenil we talked about already would be okay. But those on a biologic or JAK kinase inhibitor, that's where the vast majority of those would get IVIG if they're to receive any treatment. Again, this is only in a situation where we know that there has been recent exposure to someone who has an infection. And again, it has to be recent. If it's been a couple of weeks and now we're just finding out, it's probably a little too late at that point as well. So the bottom line is that in general, rheumatologists strongly recommend the MMR vaccine to prevent measles infection. However, for those who are already on treatment and knowing that MMR vaccine is a live vaccine, we have to be very cautious to ensure we don't run into any troubles, and we strongly recommend to have that discussion with your rheumatologist. If you're not on a disease-modifying agent, but that's something that might be coming, or particularly if you're not on a biologic, you may want to have that discussion with your rheumatologist now to get those vaccines and make sure they're all up to date, MMR included, so we don't run into issues once you're on more advanced therapies. The other really important thing that we can do is if the person who has the rheumatic condition can't get the MMR vaccine, certainly the best thing to do would make sure that they're surrounded by people who have been vaccinated. So to encourage your immediate family members, friends to be vaccinated, because not only will it help protect them, but it helps protect you as well. For more on the MMR vaccine, and in fact vaccination in general and anything else related to rheumatology, feel free to visit our website at albertarheumatology.com.